Health insurance reform on the agenda for tonight's Town Council meeting on this episode of Barnstable Today. I'm Sarah Colvin. It's Thursday, February 16th, 2012. Town Council meets tonight, and one of the items on the table is a workshop regarding the state's health insurance reform. Finance Director Mark Milne joined me on today's Barnstable this morning to explain what Town Council will be examining. So lots of chatter over health insurance reform, Mark, and I'm hoping maybe you can help make this make a little bit more sense to us and also to our viewers. Talk to me a little bit about really the big picture of what we're talking about. Why are we going through this healthcare reform discussion?
Well, the state created some new laws this year under Chapter 69 of the Acts of 2011, which requires, which put into place a process for cities and towns across the Commonwealth to make changes to their health care plan design so that they're more in line with the Group Insurance Commission's plan design. Cities and towns have been asking for some kind of relief from the legislature to help them control their rising health care costs, because cities and towns didn't have the same unilateral powers to make changes to health care design as the state does. So their plan design features have not kept up with the GIC's plan design features, which has resulted in higher premium costs to subscribers and to the towns. And so these law changes have made it possible for joint purchase groups like the Cape Cod Municipal Health Group and cities and towns who are on their own to make plan design changes so that they are more competitive with the GIC in attempts to try to reduce the health care costs to subscribers and to cities and town budgets.
Right, and really the money is really what this is all about right now. We've seen the cost of health insurance premiums and really the cost of health care services in general go up quite significantly in the past few years.
Yeah, and there's one thing that the legislation does not address, which is the big issue, is health care costs. I mean, that's a federal level issue as more than the state or local level, is that something has to be done with health care overall as far as the industry goes in order to maintain the control. This is the mechanisms that we have in place are all they do is help control the cost of who pays for what.
Exactly.
At the local level.
Of course, and if we continue to see the costs of healthcare services themselves go up, then I think naturally we'll see the cost of coverage and insurance continue to go up.
Yeah, there's no doubt about it. They will continue to climb in years unless something changes.
Exactly. So, Mark, let's talk a little bit about what the Town Council is going to be discussing tonight. Why do they need to talk about this at this time?
Well, the Cape Cod Municipal Health Group has implemented some plan design changes, and those are being part of the Cape Cod Municipal Health Group. Every entity which is part of that group, which is about over 50 different entities, including every town on Cape Cod. Those plan design changes that they've made are going into effect July 1. The Town Council can't change that. The Town Administration can't change that. So what the Town Council is voting on tonight is only the process that we are to use to negotiate the impact of those plan design changes with our workforce.
And what's on the table in terms of process? Can you talk to me a little bit about that and what they're going to choose from?
Yeah, there are two processes. The first is the one that is allowed under these new law changes under Section 21 of Chapter 32B, and that allows us to sit down with a public employees committee and negotiate the impact of the savings that we're going to realize from these plan design changes. There is a total of $1.6 million that we will save from the result of reduced premiums that will be going into effect July 1. Half of that savings, or $800,000, is going to go to subscribers because we share on a 50-50 basis with subscribers the cost of the premiums. So $800,000 is going into the pockets of subscribers. $800,000 will be to the town's budget. However, we have to share up to half of the town savings of $400,000 with subscribers. So essentially 75% of the savings is going to go to subscribers. So what we do with this process, under the new law, is to sit down with the Public Employees Committee and negotiate how do we use that $400,000 of additional savings to mitigate impacts that some subscribers may have under these new plan design changes. If we don't use that process, we have to use the traditional impact bargaining process under Chapter 150E, which is the collective bargaining procedures that you follow with all unions in the town.
And Mark, would that if that was the choice the town council made, would that kind of extend the process a little bit? Obviously, negotiations do take time. Would there be what are the advantages and disadvantages really to both decisions?
Well, the advantage of the new process under the law, it's very focused. You're talking about the $400,000 and how to use that to mitigate impacts to employees from these plan design changes. If you don't, and so that being such a narrow focus, and you have a 30-day window in which to make those, to come up with that negotiation, it's the quickest, most efficient, and effective way for us to put a plan together to mitigate any impacts employees may have from these plan design changes. It will provide us with a plan in place by July 1, when these plan design changes go into effect. We will have a plan in place. If we go under the other route, 150E, the focus gets removed from the $400,000 savings, and anything can come up. We could have, negotiations could include other items like changing the contribution rate for health insurance from 50/50 to some other factor, or some other financial issues that want to be brought up, and so the process could extend much greater beyond that 30-day period.
Exactly, and really, it's important, as we've talked about in the past, to keep that balance, to ensure that the town is saving money on these escalating costs, but also that you're not shifting too much of the burden to subscribers. And as you said, if one of those choices is made, that there is mitigation in place for those who may feel overburdened by the new healthcare costs. Yeah,
the one thing we know right now is that subscribers are going to save money. The premium rates have been approved by the Cape Cod Municipal Health Group for next year, and we know that they're going down in every plan, anywhere from a range of a few $100s to over $1,700 for people on a Master Health Plus family plan. So we know subscribers are going to save money, and we calculated that, and so that's money going into subscribers' pockets, and it's money coming back into the town, reducing the town's budget for health insurance. But what we don't know yet is how it's going to impact each person individually, because it's going to depend upon how much health care services they require, and that you cannot predict. Everybody's life changes from year to year, and you could have a year where you don't have any health care costs other than your annual wellness visit with your doctor. And in situations like that, you're going to save a lot of money under these new plan rates. But then there's going to be individuals who do incur a significant amount of health care costs because they may have a lot of needs in a given fiscal year. And so we're trying to put together a plan using that $400,000 that would help mitigate the impacts to them. There are safety nets in these new plan designs. There's an out-of-pocket maximum that's been implemented that was never there before. But there are higher copays and higher deductibles, and we would hope that we could put together a plan that would mitigate people with, who have high utilization rates, as well as those lower income employees who would be more negatively impacted by higher copays and deductibles.
Sure. Well, Mark, thank you so much for shedding some light on this definitely complicated subject, and I thank you so much for joining us today.
Okay, Sarah. Have a nice day.
Thanks. You too, Mark. Town Council meets tonight at 7 p.m. in the second floor hearing room here at Town Hall. The meeting airs live on Channel 18. With Barnstable Today, I'm Sarah Colvin.